Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine and urgent care, affiliated with Henry Ford Health System, St. Joe, and Auckland. The theme of my health talk today it's a burning topic these days, the role of vaccinations among children and adults for the upcoming flu season. As we all know, end of this summer, fall, early fall, schools open. There is a lot of surging of the new viruses that have come up. And in order to prevent us from getting those viruses, there has been new vaccines that has come up in the market. So today, my main role is to just talk about the vaccine that is for this upcoming flu season. And I don't want to talk about the routine immunizations because this has all been said in my previous lectures, and also the current CDC protocol. So now the role of vaccinations among children and adults upcoming season. And these are the recent advances, and I'm providing you with the recent updated information about the new vaccines. Can I have a first slide, please? So there has been a sustained increase reported nationwide about children, adults, senior citizens for flu viral illness. During the fall and winter months, there have been more instances of cold, allergies, and also the flu cases because children, senior citizens, they are unable to acclimatize themselves to the weather changes. So a few regular checkups during COVID era, uninsured parents and caretakers due to the loss of the job, they miss the routine regular checkup by their physicians. Next slide, please. So now, besides the other viruses that I have mentioned in my previous talk, what are the types of viruses during this season? Influenza, COVID-19, and RSV virus. So it's very interesting to know a little bit more anatomy, how the viruses are affecting the body before we understand what happened. So flu, like we said, let's talk about the flu first. The symptoms are more or less like common cold, sneezing, sore throat. Usually the symptoms of flu last for 3 to 5 days. However, symptoms of persistent fever, chills, muscle aches, trouble breathing, productive cough, they are all giving us an alarm to look for the severe illnesses, another viral illness. There has been so many research going on. The scientists have proved the fact. A recent survey, Center of Disease Control, late summer reveals at least 780,000 people sick with flu this season, and some of them require admission and death due to the complication, both children and adult. Next slide, please. So I'm going to talk about COVID-19, and we all know about the COVID-19. This is a disease caused by very contagious SARS-CoV-2 SARS-CoV-2 virus. This virus, this particular mutation of the coronavirus is SARS-CoV-2 virus. The virus, this mutated virus typically involves the lungs and can lead to the symptoms similar to that of the flu or pneumonia. The SARS, they also mutate very quickly, and they get attached to the different variants of the COVID, like Omicron, Delta, and Alpha. So the cases, total number of COVID cases are getting less due to proper immunization and early detection. However, recent data from a wastewater scan, a group that received data from the wastewater collection in 36 states of the United States, they have found this dormant virus shed in the sewage, and that says that this dormant virus remains widespread from northeast to the western part of the United States. Next slide, please. So now, talking about the RSV, the children with the RSV virus, which is highly contagious respiratory disease, cause cold-like symptoms. Most kids who are sick with RSV, stuffy nose, cough, sneezing, and wheezing. The severe cases of RSV can lead to bronchitis and pneumonia. Who are the people who are being affected by the severe cases of RSV? These are infant, immunocompromised individual, and the elderly population. This year, the RSV virus is hitting earlier than usual because usually the peaks are around January to February due to lack of vaccination. The lack of vaccination may stem from a heightened stigma and anti-vax ideology surrounding vaccines during and post-COVID era. So here is the differentiation. I got this picture for you to see. These are the symptoms of RSV virus: coughing, sneezing, decrease in appetite, and fever. Now, fever is an alarming sign as well as the bronchitis or trouble breathing. Next slide, please. So now I like to talk an interesting factor with our body immunity. There are two kinds of immunity in our body. One of them is innate immunity and others is adaptive immunity. Now, what is innate immunity? It refers to the physical barriers that prevent the pathogens from infecting the body, such as skin. Skin is a big protection. Mucus, when you cough and you have running nose, the mucus, lysozyme and antibodies. Children are born with the innate immunity that is reflective of their mother, who provide antibodies during breastfeeding. Now, what is adaptive immunity? Once the virus settles in the body, the adaptive immunity refers to an immune response to a specific antigen that gets past the first line of barrier, and that is the main principle on which the vaccines are produced. Just as the name suggests, the immune system, they can, in the body, they learn to recognize the specific antigen marker specific to the pathogen and utilize this information to synthesize the antibodies against the foreign invader. And they store the information in the body, in the blood. Next slide, please. Now, this slide demonstrates the innate immunity, like like cells in our blood, macrophage, neutrophil, dendrites, eosinophil. As we all know, in cases of allergies, there is more eosinophil in the blood. the adaptive immunity that affects the B cells. And beta cells, they produce, once the virus enters, it goes to the T cells and the B cell. And the T cells are the one that produces the antibody against that particular virus in the blood. Next slide, please. So now, just a few words about the vaccines. So the vaccines that are in the market, they take the advantage of the adaptive immune system, and they provide a safe way of granting the immunity. Now, these vaccines, whether it is RSV vaccine, whether it is COVID vaccines, the vaccine, they contain dead, inactivated, or a genetic material, or the pathogen. The vaccines, now, just so that our viewers know, the vaccines contain only a very tiny fragment of the pathogens, which is enough to stimulate the adaptive immune system and mark it like an antigen. And this antigen, they supply the antibodies, and in the form of memory B cells. Vaccination allows the opportunity to avoid exposure to live viruses, giving us a much safe alternative to general immunity against certain pathogens. Modern technologies have since advanced and improved the vaccination to be more effective against a wide variety of diseases and infections. So following, I did not go into the details. So these are the website for the routine vaccine administration to the children according to the CDC. The influenza vaccine, H flu, type B influenza, like annual flu vaccine. COVID-19 recommended vaccines are mRNA. All the COVID-19 vaccines, they hit the RNA of the virus. The recommended vaccines that are in the market are for the RSV, that is respiratory syndrome, Abrysvo, given to the pregnant women before birth. Why? Because this provides an antibody to the infant when they are born. Another one is RSV, Nursivum, to the mother's infant. They are given postpartum or immunizers. It is recommended that all individuals stay up to date with your vaccination. This is not only for personal safety, but also for the safety of our community and those who are at risk, such as children, immunocompromised individual, those with a malignancy, any adults, senior citizen with a history of diabetes, high blood pressure, obesity, who are more susceptible to any viral infection. So anyway, what I'm going to do is now, so much so about the vaccines, I'm going to talk about our senior citizens. As we know, the senior citizens are some of them are immunocompromised, and there is a background of diabetes, obesity, high blood pressure, malignancy. So these immunocompromised individuals, once they get exposed to the RSV virus or the COVID virus, they get more susceptible, since this virus, the new kind of COVID virus, the Delta virus, they settle down to the lungs. Once this virus goes to the lungs, it causes bronchitis, pneumonia, trouble breathing. So those are the things that we have to worry about. Routine vaccinations is very much suggested, and also and also keep updated with the vaccines. The COVID vaccines initially that we received 2 years ago, there are 3 types of that. Everybody, most of the people, most of us got this, but now there is a new strain of the COVID vaccine that has come in the market by the Moderna vaccine. There are three different types of vaccination that are in the market, and we can easily check from your doctor which one is there. And these vaccines, they can be given along with the RSV vaccine. So combination of the new strain of COVID vaccine, which is becoming available in next month, that is in September, and the RSV vaccines, those are the ones that will help you stay in the good health. So now there are 3 kinds of those COVID vaccines: Moderna, Pfizer, and biotech, or Novavax. I don't want to go into detail of this because this is all listed with the CDC guidelines. So even though you have received initial COVID vaccines during the COVID era, now still it is advisable to get yourself immunized against the upcoming COVID by getting these vaccines, Moderna or Pfizer BioNTech. So now these are the RNA vaccines, like in the body of, like a cells of the virus, there is a DNA and there is an RNA, the outer layer of the virus. And this vaccine, they affect the outer layer of the virus, which is an RNA, and they stimulate the antigen and the antibody formation in the body. So in order to stay healthy, again, the bottom line is to stay healthy during the fall, winter month is number 1, stay up to date with your doctor's regular appointment. Get your blood checkup regularly, especially for the elderly people. Check the calcium, sodium, magnesium levels, and depending upon what is the deficit, get it corrected. A very healthy diet, and also there is a practice of exercises, yoga, regular going to your health centers, and everything in general will help keeping you healthy, especially also the people who are in the nursing home. It is advisable to keep in touch with their healthcare professional and advise them to get a regular checkup by them, and for any symptoms not to ignore anything. For the cancer patients, it's good to check with their oncologist so that the treatments is fairly given. And in other words, this is a keynote from me, whether it is for children, adolescent, adult, or senior citizen. Stay healthy. Watch, we are back to square one. Stay healthy, eat a nutritious diet. Get regular checkups by your physician, and also take the medications as advised by them, and follow your routine. So in other words, I have talked about this whole, this slide presentation is about the combination of the RSV virus and the COVID virus, the new form of the mutated COVID virus that has been going on, because this mutated form of the virus it doesn't have horns like the initial coronavirus has. So what happens, this new kind of the Delta virus, it goes through the mouth, it is swallowed up and settles right to the lungs. Once it settles to the lungs, then develops symptoms of bronchitis, pneumonia, and breathing difficulty. So I end up my slide presentation and my talk by the last minute advice to our viewers: stay healthy, stay happy, and look for the bright future ahead of you. And I'd like to thank our producers, our video camera crews for helping me prepare this video presentation about RSV and the COVID vaccines. Thank you again.